medication has a role. It's not the end all be all. It shouldn't just be, oh, I'm just going to take medication.
Mm-hmm.
I guess the only thing I would say about that, for those people I was talking about who really have a genetic biologic depression,
Mm-hmm.
uh, sometimes medication is the only thing that really makes a difference to their lives.
Mm-hmm.
So, I mean, their lifestyle's good. They don't have any issues. They just, sadly suffer genetically, runs in their family from mood disorders.
Mm-hmm.
But going back, the three areas, number one, lifestyle is super important. Exercise, taking good care of yourself. Number two, counseling, therapy, dealing with the issues in your life. And then number three is medication.
Mm-hmm.
And there's really two sort of avenues in medication. So the first is tranquilizers like Ativan, like we talked about before, which have an addictive potential. So they're not meant to be used as the mainstay of your treatment. They're sort of rescue medications. If you think of your little blue inhaler, if you have asthma, as your rescue medication, your Ativan's kind of your rescue medication, or something to use as you're trying to get, established on a medication. So the medications that we use for depression and anxiety, they work on their neurotransmitters in your brain. So they have done some studies. If you take somebody who's not depressed and measure their brain chemicals to compare to when they are depressed, there's a significant change. So the medications help upregulate the receptors and then help gradually increase the neurotransmitter levels in your brain. So it's not like you take a pill and you feel better. You have to get established on the medication, get through any potential side effects, and allow the medication to work. And that can often take a long time. It can take every time you make an adjustment to a dose, it might take 4 weeks, 6 weeks for your body to sort of adjust. So it's a gradual process. The beauty of them is they're not addicting, and they work well. So for, people who don't like the idea of medication, it's always worth exploring why.
Yeah.
They often have an experience like, crazy Aunt M took medication her whole life and she was just bat wing nuts as when she started.
Yeah.
Or like your experience that you shared, like you had some adverse reactions after using drugs that sort of that was a trigger for you why you didn't want to take prescription medications. I have seen so many people's lives improved, quote, saved by taking medication. So I can share my experience. Are there people who try medication and they don't like it? It's not for them. It doesn't really seem to be effective. Yes, for sure. I think if we can take the stigma away from thinking about using medication to help a mood disorder, help your mental health, I think that would be really beneficial. So if somebody comes in to see me and I diagnose them, say with diabetes, Shelby, and I say, hey, your sugars are really high. You need to take this medication to lower your blood sugars. In general, that's not a hard sell. People go, okay, well, I get that. My blood sugars are high. If I leave them high, something bad could happen to me and I might die. Or if somebody says, hey, your blood pressure's through the roof. If we don't bring your blood pressure down, you're going to have a stroke or a heart attack and die. People are usually, okay, I need to do that. But if, you say to somebody, you have really bad depression, I'd argue is a good depression. Anyways, you have quite severe depression and you need to take this medication, or I suggest you take this medication to try to treat your mood disorder. Often that's a harder sell. And I think that all ties really into the stigma of mental health. So I don't think you should think of medication as your first option, but it should always be an option. One thing I like, an analogy is you're doing everything right, like you're exercising, you're taking care of yourself, your diet's good, you're staying away from alcohol and drugs, and you're seeing a therapist, good therapist, you have good sessions, but you're still just really sad. The equivalent is your car's stuck in the mud and you just keep hitting the gas and the wheels just keep going around, but you're not getting anywhere. It's time to do something else. And, the thing I always tell people about medication, it's not a one-way street. Like, it's not like, if you don't take this pill, I'm going to hire people to come to your house and hold you down and inject you with, medication.
Yeah.
I mean, you have free will here, but often I say, well, what's the downside of trying? Well, you might get side effects and you might stop then. But it has the huge potential for make an improvement in your symptoms.
Mm-hmm.
I have patients that life on medication is good and life off medication is terrible.
Mm-hmm.
They function extremely well. They're happy as any of us are happy.
Mm-hmm.
And, on medication, and if they stop, everything deteriorates. And if you sort of extrapolate that to people who have, other mental illnesses like schizophrenia, a schizophrenic who is psychotic and has having delusions, that they have superpowers or they're God or, that person needs medication.
Mm-hmm.
You can't lifestyle or therapeutize that person out of psychosis.
Mm-hmm.
Bipolar people who are manic, that means that flight of ideas, they don't sleep, they have tons of energy. They buy a fishing boat, that they're going to go fishing in the Atlantic and make millions of dollars, and they don't even know how to run a boat.
Mm-hmm.
They drive dangerously. They get involved in sexual behaviors. They spend money they don't have. I mean, those people's lives, like they're gonna ruin their life
Mm-hmm.
if they don't take medication to get them out of that manic phase.
Mm-hmm.
So I think everything has a role, but definitely medication shouldn't just be the role. And I think as physicians, we're a little bit guilty in that you come see me, I've got so many, minutes to see you, and I can't spend an hour talking about lifestyle or whatever, but I can give you a prescription.
Mm-hmm.
And I mean, I really try not to be that person, and I think the majority of physicians are the same.
Mm-hmm.
But I mean, was it back in the 60s? Everybody took Valium.
Mm-hmm.
There's an antipsychotic drug called stelazine, another one chlorpromazine. These were like came out in like the 60s, and there's actually ads, suggesting if you're a tired housewife, you should take chlorpromazine or stelazine. So things change.